Hello, everyone. Welcome to today's Whole Health Lunch and Learn. We are letting people in from the waiting room. So we'll give it just a minute here to let everybody come in from the waiting room. Welcome, everyone. Hello, all. Welcome to today's Lunch and Learn webinar. We're letting people in from the waiting room, so just give us a second and we'll get started in just a minute. Hello, all. If you're just joining us, welcome to today's webinar. We are very excited to have you. Just give us a second and let others in from the waiting room, and we'll get started in a minute. Okay, looks like we have everyone in from the waiting room right now. So we will go ahead and get started. As I said, hello, everyone. Welcome to today's Whole Health Louisiana webinar for our Lunch and Learn series. I am Liz Skilton. I'm an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center, and I'm head of the implementation team for the Whole Health Louisiana program. We're excited to welcome you to today's 7th Lunch and Learn as part of our series. Whole Health Louisiana, if you're not familiar with it, is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. The Blanco Center leads the plan's implementation and evaluation and will be moderating today's webinar. If you're unfamiliar with what Whole Health Louisiana is, it is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. WHL has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, WHL's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. I'm going to turn things over to Quen Nguyen on our staff, who's going to be our official moderator for today's session and introduce our wonderful speakers, which we're all so excited to hear from today, and the work that they're doing at the Louisiana Department of Health. So Quen, please take it away.
Okay, thank you, Liz. Hi, everyone. I'm Quinn. I'm a research associate here at the Blanco Center and a coordinator for the Whole Health Louisiana project. I'm going to be moderating this webinar and all of our future Lunch and Learn webinars along with my colleagues here at the Blanco Center. So as a part of the Whole Health Louisiana initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. We have a webinar planned for one Thursday of each month throughout June. And each webinar will touch on various topics related to the goals and objectives of Whole Health Louisiana. Our planned webinars are listed on the Eventbrite page that you all use to register for today's event. So if you are curious on what next month and our future webinars topics are, you can head to the website and check that out. So before I introduce our speakers for today, I want to mention our ASL interpreter for today is Lisa Gill. You should see her pinned on your screen to view the interpretation throughout. If you have any questions about viewing the interpreter or viewing the presentators or anything like that, please do let us know. So with that being said, I'm going to go ahead and introduce our speakers for today. So for today, we have Robert Hines, who is the Deputy Director for Planning and Performance at the Louisiana Department of Health. He is an experienced staff analyst and quality improvement specialist with a demonstrated history of working in the field of public health. He's skilled in disease investigation and surveillance, epidemiology, analytical skills, performance management, root cause analysis, and continuous quality improvement. Hines has a Master of Science in Public Health with a focus on tropical medicine from Tulane University School of Public Health and Tropical Medicine. Our other speaker is Kenyatta Royal, who currently serves as the State Health Improvement Plan, also known as SHIP, Implementation Manager with the Borough of Planning and Performance. She is a native of New Orleans, Louisiana, and earned her Bachelor's of Science degree in Public Health, specializing in community health education from Dillard University. With over a decade of experience in public health, she has focused on programs addressing critical issues such as HIV and AIDS, teen pregnancy prevention, and tobacco control. So I'm going to go ahead and hand it over to our wonderful speakers for today to begin their presentation. Thanks, guys.
Thank you so much, Quinn. We appreciate the great introduction. I'm going to share my screen right now, and hopefully you all will be able to see that shortly. So you should see our title screen. And before we get started, I just wanted to say thank you to Dr. Skilton and Whole Health Louisiana for inviting us here to speak today about the State Health Improvement Plan. It is very important work, and we're very proud of it, the work we've been doing along with the community here at the Louisiana Department of Health and the Office of Public Health. So today we'll talk a little bit about how we came about the State Health Improvement Plan. If you don't know what the State Health Improvement Plan is, we'll talk a little bit about that. We'll talk about how we got there through the process called the State Health Assessment, and how we've been really trying to reach out and engage the community members around the state in the development and implementation of the plan. And you'll hear me mention this several times throughout this presentation. It's not our plan. Even though we're proud of the work, we work hard on it, we lead it and provide the backbone of the plan. It is actually the community of Louisiana's plan. So that being said, let me get myself back to the actual correct slide because I'm on the wrong slide right now. Give me 1 second and we'll start this from the beginning. There we go. Perfect. There we go. So just to talk a little bit about what the SHA is and how we got to the SHIP. So the State Health Assessment, for those of you who may not know, is basically a snapshot of the state of health within Louisiana. So it's describing, factors about the population that are impacting health at the state level. It's a way to incorporate the community's voice and also is the foundation for that plan. So really it's looking at available data that we have in comparison to nationwide data, local data. It's taking so that secondary data from various sources. It's also taking primary data directly from community members, residents of Louisiana, and finding out, from their voice, what are the things that are impacting health within the state, within their community. So that is the State Health Assessment. It's just really a snapshot of where are we as far as health is concerned within the state. Which then leads us to the State Health Improvement Plan. So the plan is like our blueprint for moving forward to improve the state's health outcomes. So it's using those data, those findings that we have in the assessment to develop a systematic strategic plan to address the big issues. And we know that in Louisiana, we have a lot of issues around health that we need to address. The rankings came out recently, the America's Health Rankings, and once again, Louisiana is ranked at the bottom. We're 50th in overall health outcomes. And just for some context, since those rankings have been taking place since the early 90s, we have been ranked 50th, I believe, 16 or 17 times. In several of the last few years, we've been ranked 50th. With the last 5 years, the only times we weren't ranked was in 2021, 2022, or 2020 and 2021 during COVID when the rankings weren't done. The highest we've ever been ranked as a state is 47th. So we do have a lot of things that we can work on. There's a lot of room for improvement. So that being said, something like the State Health Improvement Plan really looks at, okay, what does health look like here in Louisiana? And then working on a collaborative process with stakeholders to figure out ways to address those health outcomes, right? So it's helping us to identify strategies and policies, and also formulating objectives that are measurable. And we'll show you those a little bit later in the presentation. One of the things as the backbone organization for the development of the SHIP is us helping to identify and direct resources where we can. A SHIP should also, as a collaborative, inform policy and program planning, not just for state or government work, but also externally with community organizations. Understanding what the data is showing you and what the objectives or the priorities are will help kind of align different community organizations as to where they should go or focus on. And like I said before, we'll say this multiple times, it's community owned. This is the Louisiana's plan. This is the community's plan. We are just the organization who's helping to facilitate the framework and structure so that we can guide the direction of the plan. But it is really community owned, and we'll show you how we did that shortly. Before we really get into exactly how we engaged in developing the plan, I want to talk a little bit about the state health assessment and the dashboard we created. Now, this says state health assessment dashboard, and you can go visit that dashboard, and we'll go through a demonstration of it shortly. But you can visit that dashboard at louisianasha.com to see what we're talking about if you want to follow along. But the state health assessment was built around this Prevention Institute's health equity framework. And I want to go into each of these components a little bit because it's important to understanding the scope of the SHAW and how we developed it. So first, on the far left, we have the foundations of community health in this framework, which encompasses opportunity, place, people, and healthcare. This is another word or another phrase for the social determinants of health. So those things that people don't always equate to health, but impact health in the long run, things like educational attainment, income inequality, housing. So a lot of those things within the community, the built environment, those things can impact ultimately your exposures and behaviors. For example, if a community is built next to a facility that produces a lot of environmental pollutants, that can expose people to certain toxins or maybe even carcinogens or things that just put their health at risk within the environment, which may influence how they interact with the community and the healthcare system, which may impact their medical conditions, which ultimately leads to inequalities. You may see greater disparity in the certain chronic conditions in this community that's next to this place that is causing pollution in the community than you would in other areas of the state because of those exposures. Another example would be if in the community there is a lack of stores that are able to give people access to healthy foods or fresh foods. That can in turn impact how people eat or prepare food for themselves. So that's your exposures and behaviors, which then leads to medical conditions. That may lead to chronic conditions based on the diet and nutrition options within the community, which then leads to health inequalities. So just going from left to right, all of these things kind of build upon one another that ultimately lead to health inequalities. And really understanding what those health inequalities are is the foundation of the state health improvement plan or state health assessment, right? Without understanding exactly where the inequalities are, where the greater disparities are, where the pain points are, we can't really develop an impactful plan that will ultimately help us get out of that 50th slide. So the SHAW dashboard, if you haven't pulled it up yet, was launched in March of 2021. We update this dashboard annually. And it is, like I said, basically provides a snapshot and a lot of data on what is going on. But it's not a static snapshot. It's updated annually. It's live. So the data that you are accessing on that dashboard is usually pretty current and can be leveraged in a lot of ways to provide you accurate data, as up to date as the data sources allow us to be. I'm going to hop over really quickly to this dashboard, just to let you all get and have an idea of what it looks like. So you all should be able to see the dashboard. Am I correct? Okay. So the dashboard is built around that public health framework that Prevention Institute's framework that I was just telling you about, the health equity framework. So here we have data that's broken down, demographics data, then we have the foundations of community health, behaviors and exposures, and medical conditions. And the reason that we laid this out like that is because we want people to be able to track exactly those health indicators that are impacting the overall state of health within Louisiana. So if we were to just, for example, look at demographic data, we have several demographic cuts broken down at the state level. A lot of these data have data visualizations in the form of maps, so you can actually see where the disparities are. This is just a demographic, a map that shows the breakdown of rural parishes versus urban parishes and partially rural parishes. So we have demographics of age throughout the state, race, ethnicity, sex, sexual orientation, educational attainment, all of these things that impact health disparities within the state. It's also further broken down into each region. So we have 9 regions for LDH throughout the state. So if we wanted to look at, for example, the Greater Baton Rouge area, we could look at Region 2. And we can see the age demographics for Region 2, race, ethnicity for Region 2. So any of those demographic cuts that we have can be viewed by region. Foundations of community health, same thing. We can look at this at the state level with different health indicators. So things, those social determinants, early education, early preschool education, incarceration rates, income opportunities, Alice in poverty levels. So all of these, access to internet and transportation. So all of these things that we know impact health outcomes. We can then look at behaviors and exposures. And I won't go through all of these. I just want to show you examples of how you can look at different parts of the state and figure out where the disparities are for the purpose of planning. And this is exactly what we did when we got to the State Health Improvement Plan. And so here you can look at parish level data, also regional level, regional data. So we can look at the Environmental Justice Index, right? And we can see the scores of air quality index in different parishes. You can see where the issue areas are. Medical conditions is the same thing. There's quality of life indicators, parish health outcome or parish rankings indicators. So we can see where the disparities between health outcomes between parishes, life expectancy at birth, causes of death across the state. And all of these can also be broken down into the region. So it's a really cool tool and useful for gathering data about a particular area. I know a lot of you do research. A lot of you are working in organizations that specialize in certain health outcomes. If you're looking at the data and want to, make assessments for the purposes of program planning, this is a great tool. I'm going to switch us back over to the presentation now. And a lot of this is just showing what I just showed, like examples of the data visualizations. So I won't get into that slide. Now, I want to talk a little bit about the engagement process, just so we can highlight the importance of engaging the community in a way that's impactful and meaningful. And this is why we say this is the community's project and not our project. So we spent over the course of about 2 years working with the community members, working with organizations, working with other public health partners to make sure that we were able to conduct the assessment and then develop a plan that was useful. So this began back in July of 2021. This was the initial engagement process after we had spent a lot of time developing what the dashboard would look like. So we engaged community members in that first, a first round of meetings, 9 meetings. There was one for each region. And we asked community members a lot of things like, what are the top issues of health that you are seeing within your communities? What do you envision as a healthy state for your community? Where do you see your community being in 5 years? So questions like that to just kind of get an idea firsthand from community members of what are the issues impacting the community the most that the community members care about. We also, and that was about 600 people. We also sent out a statewide survey. We had about 4,500 people participate in this survey from all regions. Every parish in the state was represented in this survey. So, of course, it wasn't a full survey, but it's representative. But that went out, and that just assessed community health perceptions around that same Prevention Institute Health Equity Framework. We interviewed community leaders and public health leaders just to find out, okay, what are you seeing within the community, or what are community members communicating to you as a leader about their concerns around public health? So those were really interesting interviews, and we got a lot of good feedback from that. And on a cool note, on the SHIP dashboard that Kenyatta will show you a little bit later, there are quotes directly from the community members embedded into each of those priority areas that we'll talk about. And I'll show you what those priority areas are next. But community members gave us feedback about what are the aspects of community, or what are the problem areas within their community. So that was really cool. After we did that, collected all that information, we had a second round of interviews to circle back to those regions. And the purpose of that was to get with the community members and show them what our findings were. Okay, this is what we came up with based on the assessment. These are the things that kind of floated to the top. This is what we're seeing from you all as the issue areas. And then we asked them, is this in alignment with what you see within your community? So we wanted to, check back in with them, find out exactly what it is that they saw within the communities, and make sure that it aligned with what we got from our analysis of the data. And then that ultimately led to the development of 4 priority areas. After we developed the priority areas, we formulated working groups around those priority areas and began meeting to develop the plan. So that led us to these 4 priority areas: behavioral health, chronic disease, community safety, and maternal and child health. And I know that several of you within this meeting probably work within at least one of these areas. Probably all of you work within at least one of these areas. These are the things that are really impactful around the state as far as disparities are concerned. And these are areas that we know we can make a difference if we work together as community members. Behavioral health, just for background, that's a general phrase that includes mental health illnesses and addictive disorders. So when you look at the State Health Improvement Plan, you'll see objectives focused around both of those areas. Our initial statewide survey identified that 70% of Louisianans identified mental health conditions, substance use, and addiction, and excessive alcohol usage as being issues. So that's one of the reasons for justifying this being in there. And when we looked at the data, the disparities also showed that that was a major issue. For chronic disease, those are any conditions that last 1 year, require ongoing medical attention. That's how we defined it. But it was pretty straightforward. And we know in Louisiana that chronic disease. We have some of the highest chronic disease rates within the country, for example, cancer and diabetes. So it made sense that that floated to the top as well. Community safety in the survey, over 50% of the respondents identified that reliable transportation, affordable housing, violence were major issues within the community. And so that community safety was defined as those things that impact issues such as those. And maternal and child health is finally, that's the well-being of women and children populations across the life course. We're talking from infants to children, adolescents, people of childbearing age, pregnant individuals, and children with special needs. So all of that is kind of captured in this maternal and child health issue area. So with that being said, I'm going to turn over the rest of the presentation to Ms. Royal to tell you a little bit more about the State Health Improvement Plan and also give you a demonstration of what that dashboard looks like.
Thank you, Robert. Sorry, y'all. You all should be seeing my screen. It should have the State Health Improvement slide up. If it doesn't, please let me know. It does, good. So we went through the background of creating our State Health Improvement Plan. All of the work that we did with the State Health Assessment and working together with our community in LDH, that is how we came up with our State Health Improvement Plan. So what is it? It's a roadmap to a healthier Louisiana. So again, it was developed collaboratively by us at LDH and citizens of Louisiana. And as Robert said, it is very important to make sure that this plan was a collective plan, not an LDH plan. While we serve in the type of a leadership capacity to bring everybody together, we are not the leaders of this plan. So the purpose of our State Health Improvement Plan is to provide is to come together and provide a strategic framework for us to be able to improve the health of Louisiana. The State Health Improvement Plan promotes health. It addresses the state's health concerns, and it can be a guide to help us with changing policy. So solving health issues around the state, again, it takes an effort of everyone, not just one group or this group. If we all work together and not silo it out, we will make critical and crucial changes to improving the health of Louisiana. So for us, we decided to establish work groups. And these work groups are important because they provide some focused support on the direction of identified priority areas of behavioral health, chronic disease, community safety, and maternal child health. The groups they're open to the public. They're conducted via Zoom. So we're able to bring people from everywhere. We know that's something that we wouldn't be able to do before because everything was happening in person. But now with technology, we're able to come together on a regular basis. Right now, we're meeting once a month. We are also able to meet with people from different walks of life. So it's not just those that are working in government or those that are working in a hospital. It's community organizations, nonprofit organizations. It's also just everyday people that decide, hey, I want to join this work group because not only does it impact my health, it impacts my neighbor's health, or it may impact the family member health. And we want to make sure you're doing the right work, the you're doing right and you're aware of things that are happening. So we do have a lot of people that are part of advocacy groups also. So they collaborate, and we've developed our goals and objectives with their input. And now we're working on the evidence-based strategies that we will use during the implementation process. And these evidence-based strategies are tailored to each priority area. So, and some actually go across priority area depending on the work that's being done. So by leveraging the work of the work group and having all of their expertise come together, we're able to make better decisions on how to improve health outcomes and reduce the health disparities that are statewide. So the work groups are actively meeting. You're all welcome to join if you're not already a part of those work groups. And I'll show you where you can join in a minute when we do the demo. We are also, so the work groups not only are working on those strategies and development and finding out what is happening across the state. We're working to continue to identify new partnerships. That's why we are always welcoming, always open. So there's no close-off date to becoming a part of the work and helping to improve the state health improvement plan in the health of Louisiana. So to just get a sense of where we are, we decided to have a dashboard, the same thing we did with the state health assessment, because we wanted to ensure that we're held accountable and our partners are held accountable. So instead of having a sheet that you can get once a year, or I come to you in 2024 and say, here, this is our state health improvement plan, and then we don't come back until 2028 when this iteration of the plan is done. We think that having this dashboard is very important. It tracks the progress towards our goals, and we'll be able to show you that during our demo. And we have the ability to perform quality improvement checks. So we are always, with these yearly updates, the updates are made in real time. Some of them are updated more than yearly because they may have quarterly reports that come out. But by us keeping track and making an effort to ensure that we are always paying attention to the health of Louisiana, we could also make real-time decisions. So if we have strategies in place, why aren't these strategies working? What is something that we may need to add or take away? What is something that can be streamlined? How can we collaborate to better the health of Louisiana? Having this dashboard that is active in keeping us in check with what we said we want to see happen for Louisiana also means that we have to be on our A game with getting out there with the community and finding out what's going on and how we can continue to improve the health of Louisiana. And it also ensures a starting point for our next improvement cycle. So I already said that this cycle ends in 2028. If this one is in 2028, we know where we are by 2028 and where we need to be moving forward. Have we met our goals? Are we on track to meet our goals? Because we know sometimes information lags, but do we see any improvement over these past few years that these strategies have been in place? That's something that our dashboard can tell us. And it's also something that it can tell you all as the citizens of Louisiana, because we can use this information, this data, not only as something for us just to keep track of the health of Louisiana, but it also can be used by our partner organizations, other organizations, especially when it comes to grant writing, creating partnerships, leading a change in policy. These are all things that this dashboard and the data that it provides can help us to improve health across Louisiana. So this one is a data visualization of what you can find on the dashboard. But since we have time, I would like to share, as Robert did with our shot dashboard, our ship dashboard. Figure out why my mouse won't get to the share screen. Okay, right now you all should see our state health improvement. And I just put the link in the chat for anybody who wants to come over and join me as I go through this demo of this side. Do y'all see it? Just want to make sure it's being seen.
We see it.
Oh. So as Robert said, we have on our SHIP dashboard, we do have testimonials for those that were engaged in our process for the SHIP in developing a SHIP through date. Some of them went through the whole state health assessment process. So they represent different backgrounds, different organizations. They had different roles as a part of it. We have a community advocate, an attorney, Dr. Weibel is a nurse with Action Health Systems. And we have our regional manager, Brad, who works at LPHI. So we have different people that are part of this, and they all gave a different take on how they were involved in the process. So you all can take a look at that later. But I do want to get into how this data can be used and like where you can find. So if you click on any of the priority areas, you'll be able to, there's a write up about it and our efforts. And then on the next page, you'll find our goals and objectives. And then beneath, you'll find our data. So how is this, where we are and the goal. So in 2022, that's where we are. That's where we were, disconnected youth. We also have it broken down by race. I think we have some things that are also broken down by parish, like on the SHA dashboard. So if you are in some of these different pairs, the darker the color, the more severe the case, but you can use this data to leverage some work that you're doing. If you work in maternal and child health, you're like, oh, we need to do something around preterm births. Well, let's see what's happening in my parish. You're in Rapides Parish, 16.7%. How can we leverage this data to actually get us some help down here? Is it higher than the state average? Is it higher than the United States average? What is it? How could we leverage this data to actually to put into action and get us some resources to my area to deal with this significant problem? So that's ways that we could use this. You could also use it in partner with another organization that's doing work around this, or that's doing work that's linked to it. Also on our dashboard, we have our partners page. So this page is very important to us because it lets you know that we aren't doing this work alone. All of these organizations have a representative somewhere amongst those work groups within the SHIP. They've done some work, whether it's with our state health assessment, our state health improvement plan. They're working hard to help us improve the health of Louisiana. So we all come together. We don't make decisions on our own at LDH. For us, it's the decision of the community members because we don't want to change this into a plan of LDH. We want to make sure it remains in the community hand, which is why it is important for as many people to join with us. So we could have a real collective. And if you still want to, still thinking about it, join in our work groups, you are able to join our efforts. You can click here to sign up for the work group. We check that every week to make sure we don't have any new members, or if we have new members, we're able to put them on our mailing list. Another thing is to receive updates. You can submit your email name for that. And if you want to connect with any of the partnering organizations, you can also click there. It'll take you back to our partner page. And you can click on most of them have a link to their website. You could also share this dashboard. We have fact sheets, but we also welcome feedback about our website. So as I said, we like to update the website, the dashboard yearly or quarterly if need be. But if there's some outdated information, maybe you saw something before we saw something came out like a week ago, and we haven't changed it yet, we welcome that feedback. Just send us an email and say, hey, I saw this, but this is the new information that came out. Could you update the dashboard? We have no problem with that. We take all feedback. So nothing is taken to heart. Because we appreciate the work that everybody does, and we know that we are not perfect and there are things that we could miss. So just take time, go through the dashboard, see how it could benefit the work that you do and how you can work with us to help improve the state of Louisiana's health. I am going to go back to the presentation. We should be on slide 11. We just did the dashboard demo. So as I said, we've done a lot of background work to get to where we are right now with the state health assessment and launching the SHIP dashboard with our goals and objectives and where we are in Louisiana. Right now, we've gone through looking through programs that are across the state to help develop strategies that we'll have coming down the pipeline, which will lead to our implementation phase. So right now we're in that area post SHIP launch, right before implementation. So just to be, let you know about what we have going on with our implementation phase to make sure that it is effective for Louisiana citizens. We are making sure we have our teams are in place, so we have leadership over our strategies that we are putting out. We also have a communication plan to make sure that the SHIP plan is sent out to everyone across Louisiana. Somehow, some way, we want everyone to get eyes on it in some form, or at least hear about it through the grapevine. Like, this is what's happening across Louisiana. This is what we're trying to do when it comes to the health of Louisiana citizens. So during this time, we're really going to need as many people as possible to join and actually take up mantle to be able to implement and send out the message about the state health improvement plan. And then because we are, again, we're working to align with existing programs. Sorry, y'all. Got along. Align with existing programs and resources that are currently in place, and seeing how we could use the resources that we have across the state at LDH, other programs, and amplify existing programs. And then ensuring that we have flexibility. Remember, with that dashboard, we're all held accountable. So we have to make sure that we're flexible and our plan is not stagnant. If we need to make a change, then we'll make that change. We're not held to anything tightly, because we know that today we could have this problem, tomorrow it could be another problem. So we have to be able to move with the waves of life. And we understand that we could face some challenges, and a lot of challenges are always about funding and different resources. So we're working on ways to try and mitigate that and address any type of barrier, especially for those in rural and underserved areas. That's why we have the State Health Improvement Plan, to make sure we can access those Louisianians and make sure they are provided with care that they deserve. And ensuring that we have sustainable efforts over time. We know things come, things go. How could we stop this fluctuation of things coming and going before they could even make an impact? So we are working on plans to ensure that everything is sustainable when we are, or as sustainable as can be when we are in our implementation process. And hopefully that will lead us to what can be true by 2028. Again, that is the end of this implementation phase, but it won't be the end of us improving the health of Louisiana. But by 2028, we can ensure that Louisiana can stop fighting to be at the bottom of the health rankings, because we definitely don't take pride in being 50th, reducing health disparities, and increasing in community engagement. You know, it's great that we have all of these programs and these organizations across the state. But if I walk by a building, if I don't know the services that are offered in that building, I'll keep walking by. We have to make intention to get out into our communities and let them know what is happening. Strengthen health systems, where we are able to actually start communicating across health systems, sustainable improvements in behavioral health. If you look on our dashboard, you could find where in the state that we have of need of mental health providers. So we can make improvements around that. Even those that are suffering with drug abuse. And sustain economic benefits. When you improve the health of those around you, we can improve the economic benefits that we have across the state. We could attract new people to come here. So those things can be true by 2028 if we intentionally work together. So just to go back a little bit, if you want to be part of our State Health Improvement Plan, you could go to our website on our Take Action page and sign up. You could also visit the LouisianaSHA.com and LouisianaSHIP.com for in-depth information about the SHA and the SHIP, and also use the data from both the SHA and the SHIP to inform your work. And if you just want to go and see who's on our partner list, please go and check out our partners page. And then you have the contact information for both Robert and I. We welcome all emails. So please feel free to reach out to us if you have any questions that do not get answered today. If you want more information, we don't mind having, you know, one-on-one meetings to go into what the SHIP is and how it how you all can partner with the ship and how their ship can actually help inform your work. Uh, Thank you all for coming and listening to what we have to say about our state health improvement plan.
Thank you, Robert, and thank you, Kenyatta, for your amazing and informative presentation. I'm gonna go ahead and start fielding some questions since we have about 10 minutes left for questions. So the first question I see asked, are the reasons for the low health rankings in Louisiana static or do they change over time? Are they mainly environmentally based or policy, for example, living next to industry versus food deserts or lack of access to care? With that in mind, is it likely that these rankings remain low in the near future with current federal interventions like the dropping of the Cancer Alley lawsuit?
Edward, that is a great question and it's multifaceted. So I'll try to touch each of the points, but I think a lot of them are interconnected. So the first part, the reason for the rankings is it's the America's Health Rankings, and they base those rankings on like 5 components. There is like physical environment, socioeconomic factors, clinical care, health outcomes, and behavioral health issues. So those stay consistent kind of across the year. And then they look at the health outcomes and weight them based on in comparison to all of the other 49 states. And that's how they get the rankings. So the criteria that they use to score is pretty much stagnant. The things that are impacting us state by state are the things that will vary. So things like how well we do in addressing access to food, access to healthcare. Policy decisions may impact some of those, the weight of those rankings, such as how we are handling things such as environmental exposures. So the criteria will stay the same. The rankings may shift and change, but until we see some real impactful change around those 5 areas, the rank will probably stay fairly low. But the reason that we're hopeful about the ship is because we're taking a different approach than what we've normally done. And um, as the current administration of the governor came in, he had some health priorities that his administration wanted to focus on. They just happened to be in alignment with the ship. So they weren't aware of the ship when they came in. They learned about it, but they already had priorities that were in alignment. So we're hopeful that because we have the administration's priorities in alignment with what the community wants and also in alignment with what we identified as issues within the ship, that we can have some progress over the next few years. Great question.
Okay, thank you. Next question asks, what metrics do you all most rely on to gauge community involvement with your projects?
So there are a few different metrics. That's a good question also. We are the Bureau of Performance and Planning, so we are all about performance metrics. We measure a few different things. One, of course, is just the count, right? How many people we have that join our work groups, that sign up for our newsletters, the open rate for the newsletters that we send out. We score, or we have basically like a customer satisfaction type rate for each of our big meetings. So we look at how well people evaluate those meetings. And we also look at the number of strategies that we actually produce based on those work group meetings. We're going to be looking at the number of strategies that are successfully implemented over the next couple of years, as well as how many of those targets that we have, those objectives, are actually met. And then looking at a percentage of increase year to year. So we want to see engagement increasing by virtue of our work group populations or sizes getting larger over the next few years. So those are just some of the metrics we use.
Awesome, thank you. That was very insightful. And then we have another question from and asking, do y'all plan on using any predictive analysis slash ML on your data to evaluate emerging health patterns?
Another good question. I like this group. So, and this will kind of touch on the next question as well. So, the partner that we have to develop the dashboards called My Sidewalk, and we've been working with them for a few years on both of those dashboards. One of the things that they just brought into the platform is a component called Sidekick, and Sidekick is a kind of an AI tool that does have some predictive analysis capability. If it doesn't already have it, that's something they've been talking about building into, but you can do some querying and kind of basic analysis with Sidekick. So we're looking at different ways that we can use the data that's available in the dashboard along with Sidekick to be able to figure out, okay, what do the trends look like in the future, and do we need to adjust our strategies? So we are considering that in the platform that we're using, which is My Sidewalk, to develop those dashboards, is looking at ways to further incorporate AI to be able to make it more impactful.
Yes, and I think you answered part of our next question. Claudia said, love your dashboards. Do you know what software your team used to create them? And you mentioned that.
Correct. That was My Sidewalk.
Another question that we have asks, how will the data for maternal and child health in the state be impacted with the uncertainty regarding PRAMs and other data sources vital to measuring these indicators? Has the potential impact of the absence of these data been assessed for the use in SHIP and SHA?
Good questions. One of the first things that we did when we noticed that there may be interruptions in how we obtain data and the availability of data is reach out to My Sidewalk. And one of the first things they did for all of their clients is send out a message to ensure us that they will keep working to make sure that the data that's available in their platforms remains available. And they've been in connection with some of the providers of like the national data sources consistently themselves to make sure that they can continue to have access to that data. Now, when we're talking about data that's local to Louisiana, one of the benefits of being the State Department is that we have access directly to a lot of this data. So even if it's not available publicly or available to be published, we still have access to that data that we can then use to inform what's going on with the SHIP activities. So we recognize that there is a potential issue around that, but we've already been working with our partners to make sure we can mitigate that.
Okay, and we have one last question that I think we'll have our time for in our last 2 minutes. Have you all seen any policy decisions in local or state governments that reference your work in SHA/SHIP? Dashboards can be super helpful for local politicians and their teams to understand complex data. So I hope they've taken the time to look at yours.
Thank you. I think both Kenyatta and I can say something about this, but one of the cool things is that we have seen the administration, politicians specifically talk about the SHIP, the SHA SHIP, and even contact us about, background information, talking points. Kenyatta just produced a great one-pager to share with them. So they are aware of the SHIP. A lot of them have actually looked at the dashboard. And we haven't seen policy decisions directly tied to the SHIP yet. We'll probably see more of that as we start to implement strategies. I mean, some of the strategies may entail policy, or pushing for certain policies. Kenyatta, did you want to add anything?
To that one in particular,
Yeah.
no, but I do agree that we are doing a lot of work with our with local politicians and state politicians to get them informed through our talking points. We have a lot of not just organizations, but because this is being pushed by our state politicians and our governor, we're getting a lot of calls for alignment. So we will see some changes, hopefully positive changes, when it comes to with the work that we're doing around the ship, because there's support from our state politicians. So.
Awesome. Thank you guys for your time and for your insight and answers to all of our questions. It is 1 p.m., so I'm going to go up. Everyone, thank you for coming. Check out the chat for important announcements regarding CEUs and the post surveys in order to get your credits. I want to thank again our speakers, our interpreter for today, for coming to today's webinar and presenting your information. It was very insightful, lots of data, and I want to reiterate that I hope the politicians in our area in our state gets to use your data and your work for something very meaningful in the future. So I'm very excited for all the things to come. So again, thank you guys for your presentation for today.
Thank y'all for having us.
Thank you.